Hello. Some patients ask if varicose veins do reoccur after being treated. Well, before answering that question, we have to stress on a fact. That fact says that varicose veins, if treated properly, and underline that. So varicose veins, if treated properly, the risk of you having varicose veins again is 3%. That comes from the veins that we did not treat because they were healthy at the procedure time. In varicose veins recurrence, there are three main factors. One is doing an inaccurate and incorrect Doppler ultrasound scan to establish the diagnostic. The fact is that we humans in each leg, so we humans per leg have about 160 anatomical variations of veins that can cause varicose veins. So they're not 2 veins and a half, how some surgeons would say. These 160 anatomical variations per leg starts with the saphenous veins, going through all the anatomical variations of perforators, communicators between the deep venous system and superficial venous system that vary very much, not only between a patient and another, but even in the same patient between a leg and another, reaching to pelvic veins, where 1 in 5 ladies, 1 in 30 men can have varicose veins coming from the pelvis. So to be able to tailor the best treatment plan for that patient, we need to have a clear image about all these veins, which is causing what and which is related to what, and based on these information, we do tailor the best treatment plan per case. In other words, there is nothing called golden method that works for everyone. No, it's a treatment plan tailored per patient, and better said, tailored per leg. Number two is using the old-fashioned surgical techniques, for example, stripping. Speaking about stripping have been invented about 140 years ago. Unfortunately, proven in science, the recurrence rate or the risk of you having varicose veins after stripping is way above 80%. That comes from the fact that's proven based on researches and studies that when I have stripping, the healing process is my body rebuilding new veins, regenerating new veins, as the body sees the surgery like I'm under attack, so the body wants to fight back. Based on research and studies again, all these new formed veins or neovascular tissue contain no valves. So if varicose veins are veins dilated that valves are not working properly, well, in these new veins you don't have valves from the beginning. So all new veins are bad veins, all new veins are refluxing veins, all new veins are varicose veins. While after the new methods, if well done, and underline that, after the new methods, laser, microwave, high intensity focused ultrasound, or even the old-fashioned radiofrequency, all these methods, if well done, the healing process is your body killing, eating, or medically speaking, absorbing the vein. That will lead us to the third point, which is even using the new methods like laser, like microwave, like high intensity focused ultrasound, or even radiofrequency, which is an older technique but still way newer than the stripping. When using these methods, if these techniques are not done properly, you will not get the result that you want. What do I mean with that? Well, inserting a needle in a vein or inserting a laser in a vein, that's not a big thing. Anyone, if learns it, can do it. But the idea is, what do you want to do with that laser once you are in the vein? What do you want to do with that microwave or radio frequency when you're in the vein? The idea to get the result, to kill the vein properly, to reach to the point where your body is absorbing, killing the vein, we have to deliver the correct amount of energy, joules, per each centimeter of the vein, per unit of time in the whole length of the vein, so the body will absorb the vein. Failing to do so means a failure of the treatment and means that the vein is still alive and living tissues do heal and you'll have varicose veins again. I'm Dr. Omar, and remember, if you have varicose veins, no matter how severe is your case, it's easy to get it treated, but things should be done properly. Thank you.